Welcome. Today we're delving into a specific type of lung disease, pulmonary fibrosis secondary to chronic aspiration. This condition arises when repeated aspiration events lead to scarring and thickening of the lung tissue. Join us as we explore the causes, effects, and management of this challenging condition. Chronic aspiration, the root cause of this pulmonary fibrosis, occurs when food liquids, saliva, or even stomach contents are repeatedly inhaled into the lungs instead of being swallowed properly. Several factors can contribute to this. Neurological disorders, such as stroke or Parkinson's disease, can impair the swallowing mechanism. Structural abnormalities in the upper digestive tract, like esophageal strictures or hiatal hernias, can also increase the risk. Furthermore, conditions that depress the level of consciousness, such as severe sedation or anesthesia or even repeated vomiting, can make aspiration more likely. In infants, congenital abnormalities affecting the airway or esophagus can be a cause. So, what actually happens in the lungs? Well, when foreign material is aspirated, it triggers an inflammatory response. This initial inflammation is the body's attempt to clear the aspirated substances. However, with repeated aspirations, this inflammation becomes chronic. Over time, this chronic inflammation damages the delicate lung tissue. The body then attempts to repair the damage, but this repair process goes awry. Instead of restoring normal lung structure, fibroblasts, the cells responsible for producing connective tissue, are overstimulated. This leads to excessive deposition of collagen, a fibrous protein, in the lung tissue. This excessive collagen build-up results in the formation of scar tissue, stiffening the lungs and impairing their ability to expand and contract properly. This reduced lung compliance makes it harder to breathe and hinders efficient oxygen exchange. Unfortunately, precise data on the epidemiology of pulmonary fibrosis specifically caused by chronic aspiration is limited. This is partly because it can be difficult to definitively link the fibrosis directly to aspiration in all cases. However, we do know that aspiration pneumonia is a relatively common occurrence, particularly in vulnerable populations like the elderly, those with neurological disorders, and individuals who are hospitalized or in long-term care facilities. Therefore, pulmonary fibrosis secondary to chronic aspiration is likely underdiagnosed and represents a significant health concern within these groups. Research is ongoing to better understand the true prevalence and incidence of this condition. The symptoms of pulmonary fibrosis secondary to chronic aspiration can be subtle at first and gradually worsen over time. Common symptoms include a persistent dry cough, shortness of breath, especially with exertion and fatigue. Some individuals may experience wheezing or chest tightness. Because aspiration is the underlying cause, patients may also exhibit signs of swallowing difficulties, such as coughing or choking while eating or drinking. They may also have a hoarse voice or experience recurrent pneumonia. In advanced stages, the patient can experience digital clubbing of the abnormal rounding of the nail beds and cyanosis, a bluish discoloration of the skin due to low blood oxygen levels. Diagnosing this condition requires a comprehensive approach. The process typically begins with a detailed medical history and physical examination, focusing on any history of aspiration risk factors or swallowing difficulties. Pulmonary function tests, or PFTs, are crucial to assess lung capacity and airflow. These tests can reveal a restrictive pattern indicating reduced lung volume and impaired lung expansion. High-resolution computed tomography, or HECT scan, of the chest is essential for visualizing the lung tissue and identifying patterns characteristic of pulmonary fibrosis, such as honeycombing traction bronchiectasis and ground glass opacities. Bronchoscopy with bronchoalveolar lavage, or BEL, may be performed to collect fluid samples from the lungs for analysis and to rule out other potential causes of lung disease. A modified barium swallow study or videofluoroscopic swallowing study can help to evaluate swallowing function and identify the presence and severity of aspiration. While pulmonary fibrosis is a progressive disease, it can be helpful to describe the extent and severity, which helps determine prognosis and treatment strategies. Pulmonary fibrosis severity ranges from mild, where lung function is only slightly impaired, to severe, where lung function is significantly compromised. Also, disease extent can be described by the amount of lung tissue affected. Pulmonary fibrosis can affect the upper or lower lobes primarily or have diffuse involvement. Finally, the progression rate, or how fast lung function declines, is variable among individuals. Currently, there's no cure for pulmonary fibrosis secondary to chronic aspiration. However, treatment focuses on managing symptoms, slowing disease progression, and improving quality of life. Speech therapy to improve swallowing function is vital to reduce further aspiration. Oxygen therapy may be prescribed to alleviate shortness of breath and improve oxygen levels in the blood. Pulmonary rehabilitation programs can help patients improve their exercise tolerance and learn breathing techniques. Medications, such as antifibrotic agents like pirfenidone and nintedanib, can help to slow the progression of lung scarring. In severe cases, a lung transplant may be considered as a last resort. Treating any underlying conditions that contribute to aspiration, such as GRD or esophageal motility disorders, is also an important component of management. The best strategy is prevention. For individuals at risk of aspiration, implementing strategies to improve swallowing safety is crucial. These strategies may include modifying food textures to make them easier to swallow, using thickening agents for liquids, and practicing proper posture during meals. Ensuring adequate oral hygiene can reduce the risk of aspiration pneumonia. For patients with neurological disorders or other conditions that impair swallowing, close monitoring and early intervention by speech therapists are essential. In some cases, a feeding tube may be necessary to bypass the swallowing mechanism and prevent aspiration altogether. The prognosis for pulmonary fibrosis secondary to chronic aspiration is variable and depends on factors such as the severity of the fibrosis, the individual's overall health, and their response to treatment. The condition tends to worsen over time, but the rate of progression can vary significantly. Research is ongoing to develop new and more effective treatments for pulmonary fibrosis. Some promising areas of research include exploring new antifibrotic agents, investigating the role of inflammation in disease progression, and developing targeted therapies that address the underlying mechanisms of fibrosis. Additionally, scientists are exploring ways to regenerate damaged lung tissue, which could potentially lead to a cure for this devastating condition. Although this disease has a grim outcome, proper management and treatment can improve the patient's quality of life.